work the overnights, and I think I'm fun to work with, but sometimes it's hard to get techs to work the overnights because it really messes with your sleep schedule. So one of the ways that I sort of bribe them, but also show them that I appreciate them, is I cook. And tonight we're having a massaged kale salad with quinoa and apples, quiche from my own chicken eggs, and pumpkin apple spice muffins and bean burritos. So I don't know. I think it helps. You have to ask them. Okay, so now we're going to round. I'm transitioning from Dr. Zahn to me right now, and Dr. Ross is going to talk to me about her surgical patients too.
So this is Joey. He had facial trauma. He's got a lot of swelling around the right eye especially.
So he was hit this morning. So is his brain okay?
I don't know.
Okay. Does he have anosognosia, or is it hard to tell?
He can't assess.
Did he get any mannitol?
He didn't. Coughs are a big concern for these people.
Okay.
So I haven't done that for him either.
Okay. Pulses or anything?
His pulses seem adequate.
Okay.
His heart sounded fine. He does have increased lung sounds. He did have some initial radiographs taken this morning.
So he looks like, so the Buprenex is gone, so this is just him.
Yep. Yep. So I've left a message. I said he's not very interactive is the way I left it.
Okay.
On the phone for an update, so I haven't heard back from him.
Do we know if they know that he could die?
No, I don't know.
Okay.
This dog is a diabetic, and it had diarrhea for the past 3 days and vomited once last night.
Do you think he's getting better though?
Oh, I think he's getting better.
Okay.
Yes.
So he's not going the other way?
No, that's
okay,
right. That's
okay.
right. So
despite, because I'm writing a splenic mass and adrenal, and I'm like, oh,
worried. As the referring vet said, let's hope it's just a gastroenteritis type episode and everything else is relatively straightforward, which certainly he's giving me the impression that's the case.
Good. I see an insulin for later tonight. Did he get his at home from his owner?
So he got no insulin this morning because
Okay.
he didn't eat. As he was due to be fed at 6 to see how much insulin we were going to give him.
Okay.
So
that'll be something I get to decide.
Yep.
Okay. I'm just listening really carefully because sometimes they get, when you get hit, your lungs bang up against your chest, your ribs, and you can get bruising. And you can see that there's a lot of swelling around his eye. But there's probably other injuries too. But the one we're most worried about is his brain because it's closest to his eye. Okay, so I'm just going to numb it to see whether or not he stops squinting so I can take a look at it a little bit better. So what I'd love to be able to see is I'd love to be able to look in this eye, the swollen eye, and see whether or not we've got a difference in pupil size. Because if we do, then that means that his brain's not okay. His owners aren't here, but I have to call him tonight and let them know how he's been doing and sort of what our plans are with him. So this is Oreo. He's a diabetic dog that came in for vomiting diarrhea. And he's had diabetes for a while. And we're hoping that he just got into something and isn't super sick because they can get really sick from their diabetes. And he looks awesome. Okay, Oreo. I'm very brave to examine your face on camera. Will you be a good boy? Hi. How you doing? Can I take a peek? Good boy. He's got gnarly teeth, but ER doctors aren't super excited about gnarly teeth. He's got a really nice haircut. I think he's the kind of guy who gets groomed a lot.
Thank you. I look at them.
You do. Very well groomed. Okay, you sound good. So our plan with him is we're going to start him on a lower insulin dose than he was on before, see if he keeps eating, and hopefully he'll be able to go home tomorrow. Unlike the kitty you just met not too long ago. So Emma had been let outside this morning and got bitten by the neighbor dog, who's a German Shepherd, and bit her in her belly, made a hole so that her intestines came out and were bulging under her skin, but fortunately they didn't come out on the ground. And then she has a puncture wound on her back. And you can see this little thing, it looks like an egg noodle. That's a drain because that's where the dog bit him as well, and it lets infection drain out instead of develop a lovely abscess under the skin. So that giant cat, Rocky, we just finished up with him, and where I just had my techs bring him back out of x-ray, and Milena gave me a really weird face as to what is going on with his belly, and oh my goodness, there's a lot going on in there. So this is his stomach right here. So anything that's black is gas, and anything that's white is either bone or fluid or organ. So like that's the bone opacity, right? So it's dark white. There's his heart, so that's what organ opacity looks like. And so in between, I've got all of this white, fuzzy, white, hazy stuff, and I should have intestinal loops everywhere. This is how skinny of a cat he's supposed to be, right? So like to here, there's his hips. So that's sort of how big he's supposed to be. And you know, if you're fat, maybe he'll get a little bit bigger, but he's huge. So that's a big kitty. The cool thing is I can take a look with the ultrasound, and that will differentiate mass from fluid, and I'll be able to see what this is. I know. Poor bud. See what I can see on the ultrasound. As Melina says, sometimes cats go upside down.
Sometimes cats go upside down.
Sometimes they go upside down.
Yes, you're very brave.
Good deal. Just a little bit. There we go.
Oh, I know you're a good cat. I'm sorry.
Sorry about this. Little cold. You'll be okay. So, ultrasound 101. Oh, this is gonna suck. Fluid is black, and if you look, you can see it's like a snow globe. You can see little things floating around.
That's horrible.
Good boy. Okay. We'll look at this under the microscope. Get a specific gravity, run the potassium. So I have to go give owners very sad news, probably, or at least that they need that whatever this is bad and needs more diagnostics. Hi, this is Dr. Loenser. I'm taking care of Emma tonight. She's doing great. She seems pretty comfortable, resting quietly, tolerating her e-collar very well. She's wearing that happy hat. So don't let her around other dogs to laugh at her. She can only be around good friends that understand her. Very good. Yeah, we just want to make sure there isn't any air in her belly. Yep. You're welcome. Take care. Okay, bye-bye. I'm back under Rocky, and I'm worried about him. I'm torn between whether or not he has an infection in his belly or sepsis from a ruptured, maybe a tumor, or if he just has tumor production. Because I'm looking under the microscope and I see bacteria, and I'm seeing bacteria inside of white cells, which means I might have bacteria that are causing a big problem with him. So I have to go talk to the owners about that, because it's probably exploratory surgery if they want to move forward. Okay, so it's 1:30 now in the morning, and I've been spending some time with Rocky, the big gray cat that I brought in earlier, and this is going to be a tough case. So I've gotten a lot of information about him, and I'm going to go talk to the owner about it, and this is going to be a tough conversation. There's a couple different possibilities, but they're all really bad, unfortunately. He could have cancer. He could have heart failure. And he could have something that has like a hole in his intestine that has caused fluid to leak out.
And you don't know which?
Not yet.
Of all the possible outcomes, what do we have to do?
It sort of depends on your philosophy of how aggressive you want to be when in a situation where your animal's really sick. Have you had experience with a really sick pet like this before?
No. We've always put them to sleep.
Okay.
Is that, I mean, you're the veterinarian.
It's not unreasonable, but I promise I'll take really good care of him tonight.
Okay. I just don't want him to be uncomfortable.
I don't think he will. I'm sorry, though. I know he's important to you.
Yeah. Alright. I guess I'll have more questions later. You'll call me if anything changes.
Mm-hmm. Yeah.
Alright. Thank you for your help.
Okay. Well, why don't I get him comfortable and have you come back and say goodnight to him, okay?
Yeah. Thank you.